What if I told you that a typical minimally invasive hammertoe correction often takes me less time than most people spend waiting in a doctor's office lobby? But here's the important part. When I walk into surgery, speed isn't what I'm focused on. In fact, thinking about speed alone can actually be the wrong way to think about surgery. Today, I'm going to explain how long minimally invasive hammertoe surgery takes me and what really matters when I'm correcting a hammertoe. I'm Dr. Lance Reeves with Cool Springs Foot Care in Franklin, Tennessee. One of the most common questions I hear from patients is, Dr. Reeves, how long does it take you to do a minimally invasive hammertoe surgery? It's a great question, but the goal of hammertoe surgery is to achieve meaningful correction while minimizing disruption to the surrounding tissues, not to finish as quickly as possible. In this video, I'm going to cover how long minimally invasive hammertoe surgery typically takes me, why some hammertoes take longer than others, what factors affect my surgical time, why faster doesn't always mean better, and how experience and efficiency help create better outcomes. Make sure you stay until the end of the video because I'll share the actual surgical time that surprises almost every patient I talk to. When patients ask how long surgery takes, there's often an assumption hiding behind the answer. Many people assume that a shorter surgery automatically means better surgery, but that's not necessarily true. A great surgery isn't measured by speed alone. It's measured by the quality of the correction. If a surgeon rushes through a procedure and misses important details, nobody wins. At the same time, unnecessary delays don't help the patient either. The goal is efficiency, not rushing. And the philosophy I use for every surgery actually comes from one of the greatest coaches of all time. Growing up, one of my favorite coaches to read was John Wooden. He had a quote that has always stuck with me. He said, "Be quick, but don't hurry." I think that is one of the best descriptions of good surgery. Being quick means being prepared, being efficient, and being intentional. Hurrying means rushing, skipping details, increasing the risk of mistakes. Every movement during surgery should have a purpose. The goal is not to move faster. The goal is to eliminate wasted motion while maintaining excellent execution. That philosophy guides every single surgery I perform. So now, let's answer your question. How long does minimally invasive hammertoe surgery actually take me? For a typical single hammertoe correction, the surgical portion of the procedure usually takes me approximately 3 to 6 minutes. That's from the first incision until the final dressing is applied. When I tell patients that number, most of them are shocked. They have spent years imagining hammertoe surgery as a long procedure involving large incisions, pins sticking out of their toes, and a lengthy recovery. Modern minimally invasive techniques can be very different, but there's a reason I give a range instead of a single number. Not every single hammertoe is the same. The first factor is whether the hammertoe is flexible or rigid. A flexible hammertoe still has some movement within the joints. These deformities are often easier to correct and take less time. A rigid hammertoe has become fixed and doesn't bend. The joints don't move normally anymore, and additional work may be required to restore proper alignment and function. As a result, rigid hammertoes often take a little bit longer than flexible hammertoes. Every patient is different, every toe is different, and every surgery should be customized accordingly. But flexibility isn't the only factor that influences surgical time. Some hammertoes require more than just correction of the bone alignment. In certain cases, additional balancing procedures may be necessary. These can include tendon lengthening, tendon balancing, joint capsule releases. These procedures typically don't add a significant amount of time to the surgery. However, they can influence the overall complexity of the correction. The goal is always the same. Create a toe that looks natural, functions well, and fits comfortably into shoes. After every single surgery I do, I spend time reviewing the procedure in my head multiple times. I literally replay the surgery multiple times using the following thinking model. How could I have been more efficient? Not because I'm trying to rush, but because I'm always trying to improve. Sometimes it's better instrument positioning, better hand placement, fewer unnecessary trips to the back table, and more efficient use of fluoroscopy. These small refinements may seem insignificant, but over hundreds and thousands of surgeries, they add up. And most importantly, those improvements benefit the patient. And this next point may be the most important thing I say in the entire video. When you are choosing a surgeon, I don't think the most important question is, how fast are you? I think the better question is, how consistently do you achieve good outcomes? Because the clock matters, but it is not the most important thing. The result is. Patients are not going to remember how many minutes a procedure took. They are going to remember whether their pain improved, whether they can wear shoes comfortably, whether they return to the activities they love, and whether they are happy with the outcome. That's what matters. Many patients are seeking minimally invasive hammertoe correction because of the potential benefits. These often include tiny 2 to 3 millimeter incisions, surgery under local anesthesia, no pins sticking out of their toes, no screws inside their toes, immediately walking after surgery, less soft tissue disruption, and a faster return to normal life. And these patients are surprised to learn how different modern minimally invasive hammertoe surgery can be compared to a traditional open technique. So how long does minimally invasive hammertoe surgery take me? For a typical single hammertoe correction, it's approximately 3 to 6 minutes from incision to closure. But the bigger takeaway is this: hammertoe surgery is not about speed. It's about achieving a meaningful correction while minimizing soft tissue disruption. As John Wooden said, be quick, but don't hurry. That's a philosophy that guides every single surgery I perform. I'm Dr. Lance Reeves with Cool Springs Foot Care in Franklin, Tennessee. If you found this video helpful, subscribe to the channel for more videos on hammertoes, bunions, minimally invasive foot surgery, and recovery tips. And if you have a question about hammertoe surgery, leave it in the comments below. I may answer it in a future video. Thank you for watching, and I'll see you next time.